The next question is from Claire Tripp. Thank you, Claire.
Thank you, Chairman. May I request that two hands joins this part of the questioning as well, because we've been talking about the same issue. If I may, I'll ask hands to speak first.
Yeah, by all means.
Thank you very much.
I have two questions.
Thank you very much.
I need to speak towards the pointy thing.
I'm trying to be clear and audible. We, and this is the co-located organisation on the Cambridge Biomedical campus, would like to lend our strong support for the proposal on the Sliproad on the M11 at junction 11. As it will assist us, we encourage staff, visitors, patients to use public transport when visiting the campus. As you know, there's already a huge problem, especially at peak time, around this part of the M11 and junction, no matter how you approach it. And given that we will have Papworth and AZ fully functioning in a couple of years from now, these things can only get worse. And I want to also highlight that the expansion of the campus is not finished by then, because we're going currently through phase 2 and will actually attract more organizations to the campus. And we think that the Sliproad option would actually go quite a way to alleviate at least the problem. And we would also see this as one of the, probably the only city deal project addressing this problem in a timely fashion. Because we otherwise be running out of time to find a solution that at least ease the problem at that part of the M11. We are, of course, aware that there are apprehensions and skepticism about the viability of the project, but we believe amongst ourselves that this actually is a viable option, and we would like to see it go ahead. We are prepared, as a matter of fact, to actually run a project that we would support to show that it is viable, and we therefore ask for the proposal to be put forward and actually put into place. Thank you.
Thank you, Chairman. And really to endorse that, mine's not so much a question, it's a position statement regarding Papworth Hospital. You know, Papworth is a founder member of the Cambridge University Health Partners and working with other organisations on the Cambridge Biomedical campus. It's also to really put a line under the fact that the majority of Papworth Hospital staff do live to the northwest and southwest of the Cambridge Biomedical campus. Indeed, about 870 staff live to the northwest, and to be explicit, 525 live to the southwest. Staff are very clear in that they believe their journey time, understandably, will take longer to get onto the campus, but they're also very willing to look at innovative ways in which they can improve their journey time. And the Madingley Road Park and Ride with the Sliproad would be part of that, where it to be put in place. My other comment would be around where the hospital will be in terms of its patient flow in April 2018. It will be servicing 70,000 outpatients and 25,000 inpatients, which is an awful lot of traffic to put into the system. Granted, they won't all be coming from the northwest, they'll be coming from a number of areas. But equally, creating good access is important. Papworth endorses the comment made by my colleague around being prepared to initiate and support with other organisations on the campus bus service for staff and wider stakeholders to demonstrate the viability of the scheme. Thank you.
Thank you. So we've got this as item 13. So we will come on to it later. Mr. Hughes, do you want to give an initial response, please?
Yes, thank you, Chairman. Yeah, as the Chairman says, this is an item on the board's agenda today. The recommendation to the board is to move ahead with the scheme, although the board needs to take a decision on that. I think, just to be clear though, this has had quite a long history through the Assembly and the board in terms of developing this proposal, and it's not going to be an easy proposal if the board decides to go ahead with it to deliver it. There are some significant issues with Highways England that we need to overcome. At the moment, there is no indication of the buses using the route, and certainly there is merit, I think, in seeing it as part of the broad West Hall proposals. needs to decide on. So really, I mean, there is, there could be some benefits, but I think actually the delivery could be quite significant as well. Just one final point I'd make, Mr. Harlan's note, there was a reference to both use by cars and public transport. Just to be clear, for all members, it's always been assumed this would be a public transport only route, and I think if we were to put this to Highways England on the basis of being anything other than just public transport and therefore only occasional use, I think we would get a very different response. So the discussion we've had so far have only been in relation to buses, which is likely to be more acceptable.
Can I just thank you both for the data, and also clearly one of the issues is going to be what buses would use this Sliproad. So clearly some of the further feasibility work should be or support it is going to be on that. But thank you for your input, and obviously, particularly after there was a debate that Councillor Biddle reported on the Assembly, we obviously need to take a view, and will take a view and be informed by what you said.
Thank you for that.
Thank you.